Hello class, my name is Tyrese Hicks, and today I'll be doing a presentation on Alzheimer's disease and its risk factors, symptoms, and a way to prevent Alzheimer's. I chose this topic because Alzheimer's affects millions of people and their families, and I want to help the community understand how it impacts the brain and daily life. I'll also talk about ways to reduce risk and support brain health. The purpose for making this presentation is to help people understand what Alzheimer's is and why it is important. I want to show how it can affect everyday life, memories, thinking, and your everyday mood. I also talk about what increases the risk of getting Alzheimer's, like age, family history, or lifestyle habits. And then finally, I'll go over some ways to help keep the brain healthy. The goal is to give information that can actually help people and their families. So the purpose really is to raise community awareness, show impact on daily life, explain risk factors, and to share prevention strategies. So we will be talking about the background of Alzheimer's. Alzheimer's is a disease that slowly affects the brain over time. It is most common cause of dementia, which means it causes problems within memory, thinking, and daily decision-making. People with Alzheimer's might start forgetting simple things and having trouble with solving problems or get confused by where they are right now. Currently, there's no cure, but there's treatment and lifestyle changes that can help manage symptoms and make daily life a little bit easier. Learning about Alzheimer's is important so we can understand how it affects people and their families. So the signs and symptoms of Alzheimer's. Some of the main signs of Alzheimer's include memory loss that affects daily life, like forgetting important appointments or conversations. People may have trouble planning or solving problems, such as following a recipe or managing money. Confusion about time or place is common also, like not knowing what day it is or getting lost in familiar areas. They might have trouble finding the right words to say or following conversations. Mood and personality changes are also common. Some people with Alzheimer's, they may become anxious, depressed, or withdrawn. These symptoms usually start slowly and get worse over time. So some of the risk factors for Alzheimer's, there's several risk factors for Alzheimer's. Age is the biggest one, especially for people over the age of 65. Family history and certain genes like the APOE gene can increase risks. Women seem to get it more than men, partly because they live a longer life. Your lifestyle can play a factor, like smoking, a poor diet, and a lack of exercise. Health conditions such as a high blood pressure, diabetes, and obesity can increase the chances of developing Alzheimer's. Knowing these risk factors help people understand how to reduce these risks. So the effects on the body. The disease affects the brain in several ways. It causes the brain to shrink, which is called atrophy. Nerve cells die and lose connections, making it harder for the brain to communicate. A protein called beta amyloid forms plaques between nerve cells, and protein form tangles inside the cell. These changes damage areas of the brain responsible for memory, decision-making, and language, and even movement. That's why symptoms like memory loss, confusion, and trouble speaking happen over time. Diagnostic tools. So doctors use different tools to diagnose Alzheimer's. Cognitive tests check memory, problem solving, and thinking skills. Brain imaging like MRIs and CT scans show changes in the brain and help rule out other conditions like strokes or tumors. PET scans, also known as PET scans, can detect plaque and tangles. Blood tests are sometimes used to rule out other causes of memory loss. In some cases, genetic testing may be done, especially if there is a strong family history. The prevention and risk reductions. Although there is no cure, There are ways to lower the risk of Alzheimer's. Eating a healthy diet like the Mediterranean or DASH diet is helpful. Regular physical activity improves blood flow to the brain. Mental activities such as reading, learning new skills, and doing puzzles can keep the brain active. Controlling blood pressure, cholesterol, and diabetes is also important. These steps can help protect the brain and support overall health. Populations that are mostly affected by Alzheimer's. Alzheimer's mostly affect older adults, and the risk goes up after the age of 65. Women are most likely than men to develop Alzheimer's. Studies show African Americans and Hispanics have higher rates than white Americans. Social economic factors that can also affect diagnostic and treatments, because people with less access to healthcare might not get too much of early support to treat Alzheimer's, or they may have untreated risk factors. Understanding which populations are most affected help target education and prevention. To conclude this presentation, Alzheimer's is a disease that affects millions of people worldwide. It slowly damages the brain and affects memory, thinking, and independency. Even though there's no cure, early recognition, health lifestyle choices, and awareness can make differences. Learning about Alzheimer's is important so we can support patients, caregivers, and families. By understanding the disease and taking preventive steps, we can help protect brain health and improve quality of life of those affected.